done, and the numbers, of course, are have come down dramatically. We have a few more examples now. We see what's happening in South Korea. So, can you give a clearer indication where you see the biggest impacts? What role does the testing play? What role does the contact tracing play? There's a lot of countries that won't have the same ability to do large-scale contact tracing the way that China or South Korea have done. It might be easier to do a lot of testing. Do you have any kind of ideas of what these things are contributing?
And then maybe Mike and DG would like to supplement. So yes, as you said, we have several countries now who have demonstrated the ability to turn the tide, to reduce transmission in countries and to bring these outbreaks under control. Korea is a good example. I have a fondness for Korea myself as the MERS focal point, and I've spent some time out there, and I've seen firsthand how the approach that the Republic of Korea can take in terms of really aggressive case and contact finding. What we're seeing that is successful are the fundamentals of public health. There's nothing special, nothing unique to this. It's just the application, the rigorous application of public health measures, which include activating your emergency mechanisms, taking this seriously from the start, looking at which parts of your government, which parts of your ministries, and all of government approach, repurposing your government to tackle this one virus. Aggressive case and contact finding. What you're seeing and testing those individuals. Testing is important to be able to know who is a case and who is not a case, and so testing must continue. Isolation of patients, treatment in hospital, care for those patients, isolation and quarantine of contacts, separating them from other individuals so that they cannot pass the virus onward. This is case and contact finding. Mobilizing your population, using every person in your population that can help fight against this virus, knowing what each individual can do, not only to protect themselves from getting infected, but by protecting themselves from getting infected, they're preventing the onward transmission, which may lead to another vulnerable person. And so these fundamentals, making sure that your labs are ready, making sure that your hospitals are ready, triaging your patients. There's a difference between what you need to do for a mild patient and what you need to do for a severe patient. Making sure that patients who require more advanced care are put in your hospitals, and having a plan for those that are more mild, those that don't require oxygen, don't require respiratory support. So what we've seen successful in many countries are these fundamental applications of basic public health measures: hand hygiene, respiratory hygiene, social distancing, assessing your own risk and seeing how you play a role in this.
There's also there's a lot of people working in this space are working very much from a view of the world that's based around influenza and a perception that once a virus pandemic starts, it's uncontrollable. So the real focus on mitigation and vaccine, and that's understandable because that's what pandemics have done in the past. In this epidemic, if we didn't have the experience of Korea, if we didn't have the experience of Singapore, and if we didn't have the experience of China, we might imagine exactly the same thing. But we have observation that tells us that there's a strong element of controllability in this disease. Now, that doesn't mean we'll completely stop it, but what it does mean is there's a real chance to blunt the curve. There's a real chance to bend the curve and reduce the number of cases that our health system has to cope with, and give the health system a chance to save more lives. So would you not use an opportunity? And then you have many people, and I've seen it, someone asked it here earlier, how can we continue to invest in the very expensive business of contact tracing? Contact tracing is not an expensive business. Contact tracing is a very basic public health intervention. It does involve interrupting the lives of a small proportion of the population in terms of quarantine of contacts, isolation of cases. And that's very tough on those individual families. But please, tell me if that's less or more expensive than social distancing measures that include locking down whole areas, cancelling all sporting events, cancelling all religious events, closing schools. Which is the more costly? And I think there's a misunderstanding here that in some ways the public health measure of case finding and contact tracing is something that requires a massive effort. Teams in Congo were chasing 25,000 contacts a day in the middle of a shooting war and doing it every day under fire. And they did it. So I think we need to reach a bit further into how far can public health measures be used? How far can we push contact tracing and case finding and quarantine of contacts? Because countries like Korea, countries like Singapore and countries like China have shown that sticking harder to that strategy has resulted in benefits. We can't guarantee that that will result in a benefit everywhere. All we can show you is that that has resulted in a significant benefit in the context of those countries. And is it worth not investing as much as you can in that until you're sure that it's not working? But as the DG said, be comprehensive, be also ready, prepare your system, and be ready to deal with the cases that in so many cases will inevitably occur. But at the very minimum, you'll suppress the epidemic and potentially reduce the number of cases per day that walk through or are wheeled through the door of the hospital. It's a very simple equation, and I think we need to maybe get away from these arguments of assuming that case finding and contact tracing is very expensive, it's very labour intensive, I've been told. I've been doing it for 25 years. I'd much rather stick with contact tracing and case isolation than necessarily shut down whole societies. I would find that much more difficult to sustain. So I think there's a degree of assumption here that we need to avoid. This is a new disease. It's a coronavirus. It's not influenza. We need to learn the lessons that we're being shown by the virus, and we need to move on to a comprehensive strategy for its control.
And I need to add to this because this is a really excellent question. You know, what we didn't also mention is what countries have done using an evidence-based approach. They're constantly learning about this virus. They're constantly learning where is it circulating, who is most affected, and they're filtering that back into their approach and making a more tailored, prioritized approach to where the effort is needed most. Every country, the DG has said this, the outbreak in each country is not uniform across the entire country. Sometimes there are certain clusters that are happening. There are certain cities that are more affected. Be creative. Be prioritized. Use the evidence that you have to actually mobilize your forces. We've seen some very creative approaches of looking at contact tracing, where they've utilized different populations to help them do that. We've seen some countries use technology to help them with contact tracing. There are a lot of tools that are out there. It's not a matter of tools, it's a matter of will. It's a matter of how do we use our best efforts to drive this down. There's no excuse to say that we cannot do this. We have shown in many countries, not we, countries themselves have shown that they are able to do this, and we must push countries, all of us, to fight as hard as they can to suppress this virus, because by doing so, you are saving lives. By doing so, you are buying more time for your hospitals to prepare. Having a large number of hospitals overwhelm your ICU is incredibly damaging, and more people will die. So do everything that you can to be as aggressive as you can in these early cases.
I'm really sorry for journalists here, but we have some people online who have been every single press briefing and were very rarely given opportunity. So I will call to Clive from Financial Times. Clive, can you hear us, please?